Welcome to our next series in the ASF Conversations. I'm Dr. Marie Culhane, and I'm a veterinarian here at the University of Minnesota College of Veterinary Medicine. And with me today is Dr. Beth Thompson. Beth, tell us about your position here at the state of Minnesota.
Good morning, everybody. Beth Thompson. I am the state veterinarian, also the executive director of the Minnesota Board of Animal Health. The Board of Animal Health in Minnesota is the state agency charged with protecting the health of the domestic animals of the state. We are a small state agency, approximately 40 employees.
And the Board of Animal Health has had a long relationship with the University of Minnesota, mostly through the University of Minnesota Veterinary Diagnostic Lab. What's the role of the Veterinary Diagnostic Lab at the University of Minnesota to the Board of Animal Health?
The Veterinary Diagnostic Lab here in Minnesota has a very important role for us. They are one of the points of contact that we have when it comes to diagnosing important diseases such as African swine fever.
What if African swine fever came to Minnesota? Let's pretend that there is a farm in Minnesota that has increased death loss. And thankfully this producer is aware. Let's say that this producer has an increased amount of dead pigs on their farm, and so she decides to call her veterinarian, and the veterinarian then comes out and sees the dead pigs. What's the next step there?
It's a very good scenario because we have seen this in the past. The next steps there would be, and would include, of course, the veterinarian going out to the farm, taking a look at the animals. The veterinarians across the state of Minnesota have specific contacts with the Board of Animal Health. In addition to that, the Board of Animal Health also has field staff that are located throughout the state. Those names and numbers are out there, they're on our website. So if the veterinarian goes out there, acknowledges that there is something going on, diagnostic samples are taken. At the same time, those diagnostic samples might travel to the University of Minnesota. That veterinarian could get on the phone with the Board of Animal Health and explain to us what they're seeing. At that point in time, we might assign a foreign animal disease diagnostician, an FAD, to also go out to the farm. And then that starts a whole process of, while we're waiting for those samples to be run at the diagnostic lab, a further investigation might be started at that farm, taking a look at what's going on with the hogs, talking to the manager, whoever's on site, bringing in all of that information to do at least an initial epi investigation of what's going on.
So that starts when the herd veterinarian then calls the Board of Animal Health and says, this is what's happening here and these are the samples that I've taken.
Correct.
Is that right? And so then the Board of Animal Health veterinarian goes out to the farm and may collect more samples?
It depends on the situation.
Okay.
It depends on what samples are taken.
Okay.
We might get out there, hopefully at the same time the herd veterinarian is out there, and we can do it at the same time, just to make sure that we are taking the right samples.
Sure.
For the veterinary diagnostic lab to run the tests.
Okay. And so let's say worst case scenario, right? The test result is positive for African swine fever. Now we have a farm that has a positive diagnosis, in Minnesota. What's the next steps there then?
The next steps would be contacting local USDA veterinary services, and that contact will then set in motion contact up to the national level. In addition to that, here in the state, and again working within state agencies, the Board of Animal Health will be out on the farm to quarantine that farm. We will start looking very closely at what's moved onto that farm, what's moved off that farm most recently. We will also be looking at drawing one of those circles around that farm, that infected site, and taking a look at whatever susceptible species might be around that farm also. In this case, African swine fever, we'd be looking for those hogs.
Just for pigs then. So the circle we talked about is a control area. The 10-kilometer control area, or that circle around the infected farm, that is something that's standard kind of around the world for infectious disease control. So let's say that we have a farm that's infected in Minnesota, and then you mentioned that quarantine was set up around that farm. It seems like a lot of people are needed for that. What would you say if we had our typical 5,000 head finisher in Minnesota that had an African swine fever diagnosis? What do you think the response, the number of people for that would be?
And that's a really good question. I probably should back up and talk about the incident command system. The incident command system, in addition to having the incident commander and his or her staff that are overseeing the whole incident, they also have separate sections of people that are specifically trained to do things within those sections. For example, there's the operations section. That section is in charge of what are we going to be doing today. So in this instance, that operations section would be out on the farm assessing whether or not we needed to depopulate those hogs, whatever other species on that farm, what we need to be doing with those. Another section in the incident command structure is the planning section. That section would be, in this instance, looking at what are we going to be doing tomorrow? What do we need to plan for on this farm or in this area for tomorrow? And then another section that I should bring up too is the logistics section. Certainly with African swine fever, if we're talking about thousands of hogs on one site, what do we need for personal protective equipment? What do we need to do if we're going to depopulate this farm? What sort of machinery do we need? What are we going to be doing with those carcasses? So the logistics section would come in and start planning for what is the machinery, what is the stuff that we need to do our job.
And because African swine fever is a foreign animal disease and it's a reportable disease to the USDA, the United States Department of Agriculture, when does the USDA get involved? Does they get involved as soon as that first sample was taken, or they get involved when the positive comes?
The USDA in Minnesota, the protocol that we have in place, of course, if there is a presumptive coming from our lab or a very strong suspicion, I would immediately notify local USDA veterinary services here in Minnesota, and then the chain for them is to then report up to national staff.
The term that I've heard that describes everything you've just talked about is called a unified incident command. So it's kind of nice to hear that there is a state response that is with the federal response, and then together there's a lot of that communication that goes back and forth through that unified incident command. Yes. The response for this particular set of 5,000 pigs would be what? What do we do with those carcasses?
And that's where, so again, going back to that incident command structure, there are different places within the incident command structure for very specific needs. In Minnesota, of course, we've got University of Minnesota, the experts in research that help us out with some of those hard decisions. In this specific example, we would be reaching out to folks at the University of Minnesota and others to help us out with what is it we need to do with those carcasses to make sure that that virus is killed. Whether that be incineration, burial, composting, those different levels of decisions need to be made, and made fairly quickly, but we would include the research when we make those decisions.
If a disease were to happen in Minnesota, some of our farms are pretty close together. If there was an African swine fever outbreak in a farm there could be many farms in that control area that would be affected. What's the steps for those farms?
Great. That lends itself to business continuity and the importance of the secure pork supply plan. Pre-planning is always important for situations like this. The fact that we have the secure pork supply plan out there, the fact that the secure pork supply plan is based on good science and science that is continuing, the farms in that area importantly would have their animals identified. They would know where those animals have come from. They would be tracking any movements that have happened recently. They would also be tracking any people that have come on and off the property, whether it be, the site manager or maybe the feed truck or something along those lines. Very importantly, in these disease situations, it isn't only about that infected farm. It is about the farms that are in that area.
And fortunately or unfortunately, we have a lot of experience in the state of Minnesota with exercising continuity of business plans, specifically the secure poultry supply that helped move turkeys from not known to be infected farms during the high path AI outbreak in 2015 continuing to move eggs from not known to be infected farms. And a lot of our poultry producers were able to stay in business in Minnesota during that outbreak. They were able to maintain that they were not infected, and then they were able to stay in business. But it wasn't without a cost.
One thing that we did learn from highly pathogenic avian influenza, certainly at that producer level, working with the producers, working with their veterinarians, and then looking back at the way we worked through 2015 and that disease, working with the counties. The counties bring a lot to the table. They know the geographical area of what's going on in that area, what assets might be in that area that we can use for the response. And then you move up, there's also the University of Minnesota Extension that can lend itself to helping out in those disease responses. And then you move up to the state level. And not only is it the Board of Animal Health and the Department of Agriculture in the state of Minnesota, but many other state agencies can lend to a response. It's all about pre-planning and communication on all levels.
So occasionally you might have unexpected death loss on a farm, and you might not have the diagnosis right away. I would hope that there is a way for the veterinarian that works with the farm to contact the state of Minnesota, the Board of Animal Health, to do an investigation that doesn't trigger a big response. Is that a possibility?
I think there is a good understanding out there that nothing really happens as far as the disease response until we have that sample test back from the University of Minnesota or whatever diagnostic lab that they are using. Certainly everybody is on heightened alert, but certainly too, there wouldn't be any large disease response until we get that testing sample back.
There's a number of things that go into making that positive diagnosis. It's not just the test results, but there's having that case definition that goes into that. So all of that comes together. The positive diagnosis is made, and then the response begins. Dr. Thompson, how easy do you think it is if I was a veterinarian up in Halleck, Minnesota, and I had something going on, how easy would it be for me to say, I need to contact somebody? How could I do that? Do you think that the infrastructure is out there and that all reaches of the state that people would know who to contact?
Again, going back to the field staff that we have throughout the state, approximately a third of our staff are located out in the field. In addition to that, there are also USDA Veterinary Services field staff out in the state. And those people are members of their community. We also make a point of our field staff will stop in at veterinary clinics throughout the year just to stop and visit, talk about any updates generally on animal health. So hopefully the veterinarians out in the field, in addition to a large portion of the producers, are familiar with the Board of Animal Health. Again, I go back to our website too, that's fairly easy to navigate.
Well, talking with you today and working with you for years through different animal disease emergencies, I feel that the state of Minnesota is in a pretty good place to handle any animal emergency that comes to it because of the Board of Animal Health, the Minnesota Department of Agriculture, and the relationship with the University of Minnesota and our really progressive producers that we have in the state here.
I think Minnesota is in a good spot, and it is because of the relationships that you mentioned.
And so any concerns, I would hope that most veterinarians out there would say, I have a concern, I'm going to call the Board of Animal Health, and that'll be a good thing. We'll get to the bottom of a problem, or we'll find out that it's not a problem, which would be even better. And so I think this has been very helpful to talk about these situations today, what might happen in Minnesota if a disease came in. And with that, I hope everybody continues to have a very prosperous fall and good harvest. I am Dr. Marie Culhane here at the University of Minnesota College of Veterinary Medicine, and it's been my pleasure to talk to you today.
And I am Beth Thompson, State Veterinarian for the state of Minnesota, and I too hope that everything dries out for our farmers.
There we go. Bring it back in here.
Do you want me to answer again?
I just answered that question. I already told you that.